Okay, good afternoon. I have the pleasure today of talking with Dean Anne Murdoch-Kinch, the Dean of the Indiana University School of Dentistry. Thank you for being with me today, Anne.
Thank you, Lori. It's my pleasure to be here talking to you and to see you again.
Yeah, it's great. It would be even greater if you were here in person, but thank goodness we have opportunities like this. So it just as a brief introduction, Anne was originally from Canada and is the daughter of a dentist. She did her dental school at Dalhousie in Halifax, which by the way, she graduated from dental school there and later was awarded Outstanding Alumnus of Dalhousie. She was in private practice for some time, and then she went back to school at Indiana for her certificate in diagnostic sciences and her PhD, which involved craniofacial genetics. And then she taught at the University of Detroit Mercy before she came to the University of Michigan. And at Michigan, she was appointed in oral and maxillofacial surgery hospital dentistry and had a practice in oral medicine. She rose up the ranks to clinical professor and then became our associate dean for academic affairs and was also honored with the inaugural Walter Schwartz professorship in integrated special care dentistry. Among many other things that she did, besides leading us through a really successful accreditation, she spearheaded on our campus our initial work in interprofessional education that then subsequently launched our IPE Center. So with that just brief introduction, Anne, I would love to just start with a simple question of why did you decide to go into dentistry? And then once, I know you were in private practice, what made you decide to go into an academic path?
Yeah. Well, thank you, Lori. Lots of great memories at Michigan, that's for sure. So my dad was a dentist, as you say, and I was the oldest of 4 kids. And I used to spend a lot of time in his office. His office was closer to my school, my elementary school, than our house. So I often would go to his office at the end of the school day so that I wouldn't have to walk all the way home. And I would just hang out in his office. And as I got older, I worked in his office. And when I was in high school, I worked as a dental assistant. And I watched him with his patients. And I thought, I'd really like to do this. I think I could do this. I'd like that, that relationship with patients. My mother was a nurse, and I used to read her journals that would come to the house and read the journal cover to cover. So I loved medicine, and I saw what my dad was doing, and I considered other options. But at the end of the day, it was really seeing what my dad had, that relationship, and how he could take people out of pain, and that he would have his own business. He could call the shots, and you use your heart, your hands, and your brain to do good with other people. It's a very worthwhile way to spend your time and as a career. But I decided to become a teacher, to go back and teach when I graduated from dental school. And dental school wasn't completely easy for me. It was pretty good the first couple of years. I was a good student, but every one of us hits a speed bump at some point in time. And my senior year was very difficult. And my faculty taught me very well. I got a great education, but I, did not have a good experience. I left and a little bit traumatized by the whole thing. But 2 years later, I was invited to come back and teach. And it was a redeeming for me that the faculty who knew me thought enough of me to bring me back to teach. And then I realized that my 1 day a week that I was teaching was what I looked forward to the most. And I love being part of a team. I love working with the students. I love the whole act of teaching. And I thought, this is what I want to spend the rest of my career doing. And importantly, can I make it better? Can I make it better than it was for me? And so that's really the reason I became a full-time educator And then the rest is history.
And at that point, how did you decide diagnostic sciences in Indiana?
So I love medicine, as I said, and I love the diagnostic sciences because they were the area that was most connected to medicine. Oral radiology, they needed a radiologist at my school. And I thought, well, I could do that. I could go back to school and become an oral maxillofacial radiologist and come back to Dalhousie to teach. And so there were only a few programs where I could have done that. And there was only one in Canada, but there was a couple in the United States where I applied. And the program director here at IU actually had been a faculty member at Dalhousie. And so it helped me choose IU because I thought, well, at least I know somebody there. And I liked that their program wasn't just radiology, it was diagnostic sciences. So I got oral medicine and oral path as well. And then they accepted me. So we decided to leave. My husband and I had only been married a year. Well, less than a year. I said, I think I might want to go back to school. And, it was like, he was a good sport. And he said, okay. And we moved down here to IU. And it was the best choice ever because really the environment was perfect for me here. The fact that the people who taught me were really trailblazers in creating new disciplines in dentistry. I ended up working with faculty member David Bixler, who was an oral facial geneticist and one of the founding members of the American Academy of Medical Genetics and the American Board of Medical Genetics. And so, he opened doors for me to work with the genetics department, the diagnostic sciences faculty, the oral medicine, radiology, oral pathology faculty, again, treated me as a colleague. And so after the memories of, dental school being very challenging and you were a student, there was no way people were saying you were a colleague. To come and actually be treated as a colleague was really exceptional, and to be taught by the people who wrote the textbooks. Again, IU has a similar history as Michigan in that the textbooks pretty much came from Michigan and IU, and there were a couple from Ohio State too. Prosthodontics, I know we had the voucher textbook there, but yeah, I was just couldn't believe that I was at the school where the people wrote the textbooks.
It just shows, how important people are in guiding your path. Right?
Absolutely. Mentorship and creating an environment where people feel supported and that they can really fulfill their true potential. It makes all the difference.
Yeah.
People who believe in you, that's also very important.
Yeah.
Yeah.
So I'm going to take a little walk down memory lane, or ask you to. I know you've been at multiple dental schools, but I think you spent a formative piece of your academic career at Michigan. So I'm wondering if you would share a fond memory of your time at Michigan.
Oh, certainly. Well, so many happy memories at Michigan, no question. I spent 19 years at Michigan. And as we had talked previously, the two mountains in one's career. The first mountain is that time you build your competencies, you achieve the goals you set out for yourself. And then the second mountain is when you shift your focus on leading and supporting others. But Michigan, fond memories. First of all, pictures there you saw of Dr. Marilyn Woolfolk. She and I got to work together most closely when I was Associate Dean for Academic Affairs, and her wisdom, her kindness, generosity of spirit, and just really being an exceptional role model.
She was Assistant Dean for Student Affairs at the time, right?
That's right. She was Assistant Dean for Student Affairs. And even though I was her boss, she taught me more than anybody else about what I need to know to do my job. But also just her the way she conducted herself in her career was tremendous example for me to follow. And she taught me so much about things I really needed to learn about diversity and inclusion. And she was patient with me, even though I was kind of a slow learner early on. But just I value that my friendship with her and the time I spent with her. Then Renee Duff followed her in the role. And again, it shifted. It was a little different under Renee's tenure, and she's still there and she's doing great. We were friends before she stepped into the role, and we got to work together very closely and sort of rebuild along the way that we built the new curriculum, the supports for students, and new initiatives, new programming, and our book club social engagement, which I won't say anything more, but it's important to have relationships with people that you trust and that it's not all about work. And I had a group of women faculty who we started doing book club with each other. There weren't really books involved, but it was more social. And just again, happy memories of those informal conversations and just enjoying each other's company. Well, I'd have to say, other happy memories. We saw the golf outing. I'm not much of a golfer, but I had a lot of fun engaging with alumni during those events.
You were, well, there weren't many faculty that actually engaged in the golf outing. And I suffice it to say, I think you were the only female faculty that played most times. But
so Marilyn and I were the only two female faculty.
So in my mind, you were a fabulous golfer.
Well, you just keep thinking that way. Yes. So I would say the other memories relate to just the interactions with my faculty colleagues. One of the things that was just really a privilege for me, being there for 20 years, I got to know everybody in the school. I knew all the faculty, I knew all the staff, and I knew what they did. I knew what their interests were. I could help connect people with each other because of that. And, exceptional people. You talk about the people. People are what you remember. You remember the things you did together, the celebrations, the happy celebration that Coda was over and we did a good job. The inauguration, the professorship was something I'll never forget. Really amazing honor, and what a day. And then the work with the IPE Center, our first Health Professions Education Day, working with Dr. Stolberg. We were the co-chairs of it, and just being proud of all the work that was on display. So again, it's about the people. The first Pathways Day, that was another happy memory. Yeah. So, yeah.
So speaking of the professorship inauguration, this is one of the pictures from the Walter Schwartz inauguration. I'm curious, I know you also participated in ELAM, which is the Executive Leadership in Academic Medicine, while you were at Michigan. But I'm curious, can you comment on things that you learned at Michigan relative to leadership that are serving you well now as a leader of a major dental school?
Yes, thank you. Well, we say Michigan is leaders invest, but it actually isn't just a slogan. I think that I would have to say that the opportunities that were provided to me as a faculty member for professional development and growth. The other thing is the environment. My faculty colleagues were exceptional, and working with people who set such high standards for themselves, it pushed me to try harder and to aim higher. I remember when I was initially recruited to Michigan, and I talked to a number of people, including Lisa Tedesco. Jed Jacobson was the one who recruited me. He was the chair at the time. And he said, well, maybe you should talk to Lisa Tedesco to learn about this environment. And I spoke with her, and she said, oh, yes, and you'll have time, to go watch your kids play sports and everything. Well, I did, but the more important thing,
not as much as you thought you would.
No, but the thing is that people like that, I was working with people like that. that really set the standard. And I had opportunities, even not only in the dental school, but at campus level to interface with people who are really at the top of their game. The other thing is this, and I do tell junior faculty and students, I was counseled that you should focus on learning the leadership skills that you will need in the future and focusing on those experiences and opportunities to serve that you will learn what you need to learn rather than focusing on the titles. And I really, I think it reflects my generation perhaps in that I was not in a hurry to get a title. I was in a hurry to learn as much as possible, and every opportunity presented to me. And again, opportunities were presented to me because people, mentors and sponsors thought of me to provide those opportunities and believed in me. I was able to then do those things. But that, again, it's the part of the environment, but also focusing on what is important at the time. The other thing is not being afraid, not basically having the courage to say, I see a problem and I believe I can help. I'm going to do it. Not wait for somebody to ask you, or it's not my job, or, I really saw that can-do attitude among my colleagues. But I also benefited from people who gave me opportunities and allowed me to learn and grow, and including providing resources and time to be able to attend things like ELAM. But even before that, carving out time for me to do clinical research training. I was supported by my chair at the time. So, it's having the right focus, but having the people around you and pushing yourself just to aim higher.
I think your comment about the titles is really important because, another way to look at that is there's so much need and opportunity for leadership that doesn't go along with a title. In other words, we can all lead regardless of, what our current job description or position is. And the more you demonstrate that leadership, the more likely the titles will come along with it.
Absolutely. Absolutely. The other piece of that, I think it's important, and as you gave me the questions to think about ahead of time, I think it's important that leaders do the work on themselves. You need to know who you are and what matters to you. And you need to do the work, the personal work that's needed to allow you to, the ego to be pushed aside, and that you truly are focusing on serving others. Now, this may come as a surprise to you, and I'm not saying it to embarrass you, but I remember when I was on the search committee for the department chair for periodontics and medicine.
Yes.
And I remember when you interviewed, I still remember to this day, and like, what was it, like 15 years ago or maybe longer? I don't know.
Probably longer.
And you had said, when somebody asked you why you were interested in the position, you said you felt that you'd achieved a lot already in your career, but that it was time for you to serve your colleagues. And that has resonated with me in that I believe my leadership philosophy is that of a servant leader. And I do think that it can happen even if you're a junior faculty member. You can be a servant leader without the titles, no matter what stage you're at and what your role is. And that is a really great way to spend your life, in fact, to fulfill your purpose. But also it allows you to learn and grow and develop the skills you're going to need should you aspire to a title eventually.
And it's incredibly rewarding.
Incredibly rewarding, incredibly rewarding.
I think if I remember right, that search committee session was up in the FAL.
It was.
Yeah. You kind of tend to focus on some of these things. The other things I remember giving my seminar for that, but I also remember going to dinner and I had a cold. And, that was back in the day that you just went to things, matter whether you were sick or not. Right now, now you would not do that, of course. But I remember I was just like holding back, from coughing and just trying my hardest to just be, squelch this cold. And yeah, anyway, that has nothing to do with servant leadership.
Oh, well, but you did a good job, because all I remembered was you said, I want to serve. It's my time to serve. And I just thought, yeah, that's it. That's it.
Okay, I've got one other set of cool photos here. And the next question I wanted to pose to you is around what you brought into your current role as dean, your background in academic affairs. And I mean, as you said earlier, all the way from the start, your interest in teaching and education, it then developed into your passion for academic affairs and curriculum. And I'm curious if you would share the importance of curriculum and our educational models in the future of our profession as a whole.
Well, thank you for that question. I think it's the most important thing. So the purpose of a dental school, the mission is broad. The mission is not just education, it's patient care, research and discovery. It's the foundation of our profession. It's the way we move forward. But training health professionals who are ready to take care of people in our community, that is truly the purpose, in essence, of a dental school. And it's a daunting task when you think of it. It's also pretty amazing when you think that we transform a lay person into an independent health professional, highly skilled
surgeon.
Yeah. Not with the knowledge, the compassion for people, and the hand skills to deliver skilled care, and manage a small business usually, or be able to function within a team. It's amazing that we do this. As a dean, I think my background in academic affairs, every day it helps me. It helps me to lead the school. And, one of the things that drove me into academia was that I saw that it could be better. And as I was trained as a scientist, I now can say, and yet we haven't yet determined how best to train a dentist. There's still so much to do to actually identify the science basis, the evidence-based approach to creating that health professional to serve the needs of the public, not only here in our own state, but globally. So I'll never be finished, but I think that approach is so incredibly important to bring to the role as dean, because this is the purpose of a dental school. And as you know, Lori, the model of dental education is not really sustainable as it is currently. And how do we move towards the future where, frankly, dental schools need to be efficient and effective healthcare delivery systems that train healthcare professionals for the future and generate new knowledge? And engage and give back to the community all at the same time. It's all about educating people. I see my role as a leader of a dental school as I am responsible for the professional development of everybody in my school and preparing them to innovate and be creative and create those new models that we need to position ourselves for the future. So understanding curriculum, understanding that basic purpose of the dental school, and that there's need to be scholars about everything we do, is really a nice integration of all the things that I learned as a scientist, as an educator, as a clinician, and now looking more broadly at national, the national environment, the global health environment, advocacy systems, the big picture. It's all really, the foundation is about how do we train the healthcare workforce for the future. And we're not there yet. We still have a lot of work to do to actually identify what those goals should be, the program goals, because I do think that we've been very focused on training people for a particular model, but that model is not going to be everything. It already isn't all the places where a dentist or other member of the team is going to be working. But we also need to help them create those new models for the future and be leaders in them. And it all goes back to understanding curriculum and then taking advantage of the fact that the curriculum is the vehicle by which we transform the profession.
Yeah. When you're talking, it's reminding me of the Pathways program, which, you were responsible really for fostering and launching. And so I'm curious how you see that, because when you're talking about all of this change, how do you deal with a traditional educational model to be able to deploy a future that's different?
Yeah.
I mean, do you think the Pathways program, helps in that regard?
I do. So we've not implemented exactly that here at IU. We do have a series of electives, and we are constantly, we will be launching a revision of our curriculum. I mean, all dental schools revise their curriculum. We have to, but we in our strategic plan have identified some goals to transform our education system. And that includes opportunities for exposure to other paths. Like, the only path isn't to go as an associate and then go into private practice and buy your own practice. I think Pathways was ahead of its time. In fact, I know that it was a model. I often was asked to go speak at other dental schools to share what we did and how we did it. I think that it goes back to the original concept for the new curriculum. It's not a new curriculum. It was, it's 10 years old, 11 years old, 12 years old. But that premise that we really need to provide opportunities and choice, providing choice for our students to explore while they're in school, and help them, again, gain those experiences and perspectives that they're prepared for. They could go back and go into private practice and just be more well-informed and be able to apply these concepts into their own practice, but that we're really training people who could step up and be the leaders in the new models, and be leaders in academia, industry, public health, private practice, insurance, wherever, advocacy. It was a vision. It was, obviously a vision that was ahead of its time, but I think now is, all of our schools should really be doing that. Something like that to provide those opportunities. But
what I really love about it is the individualized piece of it, that people can carve out their professional identity through that program.
I think that's actually the critical piece. The other piece is it did provide a way for students who wanted to do additional study, for example, an MBA or a master's in public health, or take a year out to go to NIH. So I thought that was brilliant. And students want choice. They don't want to be cookie cutter. They want to be able to follow their passion. And yet, we still struggle with all the things we have to train, we have to teach in 4 years. I do think, we start looking at changes in medical education where they're saying, what, we're not going to make everyone go through the same 4 years. If you want to do X, you're going to get on your path sooner. And I think those are the kind of strategies we should be embracing in dental education. Accreditation will have to adapt to it as well. But I'm excited about, again, those new models, and starting with, what does the public need? That should be the driving force as to what is the curriculum.
So you're a leader in our profession. You're the dean of a Big Ten dental school. What's your perspective, really from the 10,000-foot view of the areas of the greatest potential impact in our profession as we move into the future?
Well, I think public health and research and discovery and putting the two together, that is going to be the area of greatest impact. I think that the pandemic has shown us, and the latest NIH, NIDCR monograph on oral health in America
Yes.
really sums up that urgent need for the public health infrastructure for oral health to be rebuilt, and the opportunities provided by research and discovery and innovation and technology to help transform oral health in the United States and around the world. And really, when we talk about the US, we have to talk about global because we're all connected.
Of course.
That combination, technology and science, absolutely needs to provide more access to oral health.
Exactly.
It shouldn't be driving more for those who have the means and don't have the disease. I'm sorry, I'm outspoken about this because I see a complete mismatch. We have wonderful technology and wonderful advances available that have been the result of research and discovery in academic institutions as well as industry. And much of it's been funded through NIDCR, NIH, and some has been privately funded. But most of it is beyond the reach of the people who have the most need.
Yeah.
And so really the promise of technology and research and discovery has to be directed towards reducing oral health disparities and health disparities.
Yeah, I couldn't agree with you more. And I mean, the beauty of this opportunity now is the technology can help to facilitate that,
Yes.
which we were more challenged to do in the past.
Yes.
And so it's an opportunity for us to improve care across all, individuals.
Absolutely. But then it comes back to dental schools. How are we going to do that? And it's an urgent challenge for us because investing in technology obviously is not inexpensive. It changes so fast that's another aspect to it that makes it challenging. But getting it into the hands of our trainees during school is essential for them to be ready to go with it. But then how do we get it distributed more widely, and how do we merge public health infrastructure with the technology? And we're not just talking about digital dentistry, we're talking about things like wearable sensors and understanding how to change behavior. I mean, that, if we can harness behavior change, we can help make people take ownership of their own health. And that is really the strategy that's going to be most sustainable.
And how about, just making our electronic health records more operable?
Yes.
And more available for people to learn from.
Yes. Learning health systems, but integration and engaging more health professionals. So we all can be amateurs of each other's discipline, and we work together, getting other healthcare professionals up to speed and understanding oral health. And whoever is there should be one of those vital statistics, not just your blood pressure, not just your pulse, not just your respiratory rate, your temperature. What about your oral health? Other health professionals should be trained on how to do screenings and ask the right questions of our patients. So we broaden the workforce, if you will, but also I think we can help empower patients. And the sharing of information through integrated health records or exchange of health information is going to be critical for that as well. And dentists can be doing more, and dental hygienists as well can be doing more to help with systemic disease. We have skills that can be put into play. We've seen the pandemic has, my state, and I think probably Michigan too, dentists are now permitted to give vaccinations. And, there's a lot of other things that we can do. We just haven't had the opportunity to do. With physician shortages around the country, I see dentists as being primary care providers. So more of a blurring of the boundaries between health professions, I think is another opportunity in addition to what technology brings. It's all a comprehensive, multi-pronged approach.
It's really an exciting time, isn't it?
It really is, because I think we're going to see unprecedented change in the next decade.
Yeah.
Yeah. And we've got a blueprint for it from the monograph.
Yes.
A blueprint for change to advance oral health.
Yeah. So, one of the key purposes for this interview is to support students in their leadership paths. And so I'm curious if you would give some words of advice to any students who might be listening for their leadership path.
Yeah. First of all, believe in yourself. Second of all, I do think it's important to reflect, to think about what you care about the most in the world, and understand your own strengths and where you can make a difference.
So it's kind of like you're knowing your core values.
Knowing your core values and where your passion is. Defining your purpose. I mean, for all of us, I think we may say, I thought my purpose was to be a dentist in private practice. And, but over time, being willing to change your mind and say that it's okay. You can change course. Seeking out mentors and role models, and having courage to take risks. That's essential.
Yeah, no, it's really nicely said. Yeah. Knowing your passions, your core values, identifying people who can help guide and support you, in other words, mentors, and then having the courage to do it.
Yeah. Yeah. Yeah.
Awesome. Caroline, is there anything else you'd like to add today for our conversation?
Well, I just want to thank you, Lori. My time at Michigan was phenomenal, and you are my role model.
Oh.
So not to embarrass you, and I know you didn't pay me to say this. This has been a challenging time to lead, and I think that's an understatement. But difficult times when it's sensitive issues or not an obvious path of what to take, your thoughtfulness and taking the time to think, not react, is so important for all of us, even in our one-on-one conversations with other people during these times. I think that's something that's probably great advice for all of us. But when I watch your leadership, the time I get to spend with you when you were the dean, or as you still are, but also as chair, your thoughtful approach, and I often would say to myself, well, what would Lori do in this situation? And then I try to do that, or, it's like, if I can't figure it out, I'll say, well, okay, what's Caroline going to do? But no, it's just helpful for me to have had another strong woman dean who I've been able to watch closely. It's been really incredible for me and has helped me so much. So we need to be that for the other women around us, not just the women, but you and I are both the first female deans at our dental schools. And when I came into this role, I thought, yeah, well, that's true, but let's just sort of focus on whatever. But it means a lot to people. to
Yeah.
see somebody like them being able to take on this kind of leadership role. And it's inspiring to people, and it tells them, yes, you can do it too. And yes, you belong here. So, you know, I want to thank you for that. But I also recognize now I have to take on some of that and that responsibility to
Well, I'm
be
sure
a role
there's
model.
plenty of people at Indiana looking up to you as well. I have to say how fortunate I was when I became dean to have you in the role as dean for academic affairs. And I probably took that for granted more than I should have, because, you know, you were just so expert in your role that I could focus on other things, which, you know, is really key.
Well, thank you. I love the job, you know, that helps too, you know, and it makes it a lot easier. And I, you know, appreciate the people around me that help me focus on the big picture, because they do their work, they do it at a high level, and I don't have to worry about it. Just be grateful for their leadership. So, yeah.
Yeah. Well, you had a huge impact here, the many years that you were here, and we appreciate that. And we miss you.
Well, I miss you all too. Those pictures make me teary. It was such a big chunk of my life,
Yeah.
as well as my career, and such happy memories, such great people.
So
I'm not gone that far though. I'm only 4 hours away. So
No, I know. Do you still remember Go Blue?
I do. I don't know if I can. Do you want me to say it
Can
for
you
you?
do it?
Oh my God, if this gets out there.
We won't
Well,
show it to anyone in Indiana. No,
yeah.
it could be Go Big Ten.
Go Big Ten, go Hoosiers, go Hoosiers, go Blue, go
No,
Jaguars.
actually, I have to say one of the things that, you know, I was very happy for you when you became dean of Indiana, because I know, one, it was something that you were really excited about, and I knew you would do a fabulous job. But the other bonus was that you were staying in the Big Ten, and we could still interact, and it's been really fun to go to Big Ten dental deans meetings with you.
It's been great, and
Yeah.
we have such a great group. I think the Big Ten dental schools are the best in the country, and we have such a great collaboration among us. We have a friendly competition in that, you know, our students are from the same areas, but I think in general, very collaborative, and just it's so nice to have deans to talk to who understand what it's like, and we can rely on each other and share good information and advice. And, you know, I still root for Michigan football when Indiana's not playing.
Okay, thank you for taking time with me today, Carol Ann, and thank you for all you do for the profession.
Well, thank you, Lori, and thank
Okay.
you for your leadership, and I hope that your students benefit greatly from these videos.
Thank you.
Okay,
Bye-bye.
bye.